parasites inhabiting the small intestine will present by manifestation of the small intestinal affection, which is in the form of diarrhea. The diarrhea of small intestine have certain characteristics. It is characterized by being voluminous, as there is major defect in the absorption, and the small intestine is a major absorptive organ in our body. So any disease will cause watery, voluminous diarrhea associated with periumbilical colicky pain, as the small intestine belongs to mid-gut. So the pain will be perceived in the periumbilical region. This is what is called small intestinal diarrhea. If this parasite persists for a long time, chronic infestation, it will cause damaging of the surface area of the small intestine, so it will lead to defect in absorption and malabsorption syndrome and growth retardation. So we should know which parasite cause chronic infestation to predict the clinical picture. If it causes what is called enteropathy or chronic infestation of small intestine, this will ultimately be manifested by malabsorption. However, if these parasites inhabit the large intestine, they will present with diarrhea of large intestinal characteristics. The large intestine is only responsible for absorption of 10% of water. Okay, so the diarrhea of large intestine is scanty. Usually it is an inflammatory type of diarrhea, so it is usually associated with mucus and blood, and it is named dysentery. If the habitat of the parasite involves the last part of the large intestine, which is called rectum, it will present by manifestations called tenesmus. Tenesmus, okay, this is the manifestation of the parasites which involve the rectum. So we should know whether it is a large intestinal or a small intestinal to predict the clinical picture. And if we are in the small intestine, which part of the small intestine? If it is in the proximal part of the small intestine, maybe it may present by gastric irritation manifestation, like nausea, like vomiting. So I should know the exact habitat of every parasite to predict its clinical picture. If it inhabits, for example, the ileum, which is the last part of the small intestine, the ileum, as we all know, is responsible for absorption of certain type of nutrients and vitamins, like vitamin B12. So they will suffer some manifestations of vitamin deficiency. So I should know whether it is a small intestinal or large intestinal. And in each, whether it inhabits the proximal small intestine or the distal small intestine, whether it inhabits the large intestine, the cecum, or the ascending colon, or the transverse colon, or it is a parasite affecting the left side colon and the rectum. It will present with quite different manifestations. Also, we should know which parasite cause malabsorption. Those causing malabsorption cause chronic infestation and affecting the absorption. We should know which intestinal parasites causing eosinophilia. All these are clues in the case scenarios and the question in the exam. Eosinophilia is the reaction of the body to tissue invasion paraparasite. So if the life cycle of this parasite is confined to the small intestine, it will never cause eosinophilia. Only if the life cycle of this parasite involves invasion of the host tissue, it will elicit eosinophilia. So I should know which type of intestinal parasite in particular causes eosinophilia, as it may be the clue in the problem I have to solve. This is very important. We will come to our first worm belonging to trematode or flatworm, a common small intestinal parasite which is called Hetrophyiasis heterophys. What is the clinical presentation of Hetrophyiasis heterophys? It inhabits the small intestine. So at first, if the infection is light, a small number of parasites, it will pass completely asymptomatic. However, if we have heavy infection, this will be presented by manifestation of small intestinal diarrhea, as we mentioned before, mucus or watery diarrhea, voluminous, colicky, periumbilical pain, and since it inhabits the proximal small intestine, it may cause gastric irritation manifestation in the form of vomiting, and this may ultimately lead to weight loss. This is the intestinal heteropyiasis. What is particular to this worm, and I should know it? Two words. First, that it is transmitted by eating fish. It will be another clue in the problem. And the second, that I fear very much from heterophysis, not for the sake of intestinal manifestation, but for the sake of ectopic heterophiasis. The egg of heterophysis is characterized by being very small, so it may reach the bloodstream and reach apparent sites. When it reaches apparent site, it can elicit the formation of granuloma in ectopic areas, and this granuloma is commonly go to the heart and cause myocarditis, and the patient may present by symptoms and signs of ectopic heterophiasis in the form of signs of myocarditis, which is in the form of dyspnea, lower limb edema, fatigue, maybe abnormal heart sounds. These are the presentation of myocarditis induced by heterophiasis. Or it may reach a more dangerous site, which is the spinal cord or brain, leading to neurological deficit in the form of transverse myelitis, loss of sensory and motor function. That's why I am fearing very much from heterophysis, not for the sake of intestinal manifestations, but for the sake of the ectopic heterophiasis. How can I diagnose heterophiasis? By direct evidence of the presence of eggs of heterophysis in the stools. If I want to discover or diagnose the ectopic form or extra-intestinal form, maybe I take biopsy or autopsy, because I'll never take biopsy from the heart. The patient must be dead to take a biopsy. I find in these tissues a granuloma induced by the egg of heterophiasis. How can I treat heterophiasis? As trematodes, the drug of choice for trematodes is praziquantel. It is given in a single dose of 10 to 20 milligram per kg. Thank you.